thanks for coming with us today. We're going to talk about bladder cancer. We're the disability doctors, and we talk about different conditions. And today, bladder cancer is on the menu. So we're going to talk about it. One of the things about bladder cancer is I don't diagnose it. I don't know if you've ever diagnosed bladder cancer.
No, I can't say I have.
No. So when veterans come to us, it is already diagnosed. And so you go to a urologist, you go to an actual professional for this. Most of the time when I see bladder cancer, I don't see active bladder cancer, although sometimes it does happen. Usually they've gotten the bladder cancer from being exposed to Agent Orange in Vietnam or the water at Camp Lejeune. So the VA has a couple different things that they've already conceded. If you were in this place at this time between these years, we concede the fact that bladder cancer is probably service connected. So.
Yeah, and why do we care about bladder cancer? You know, I had bladder cancer, and they gave me some medicine and stuff, and they said it's gone. I mean, I don't pee very well now, but like, what's it matter?
So there's a couple things about bladder cancer. Yes, there is always a possibility that you could have, it metastasizes, it'll go to a different place, it'll cause different problems. And so bladder cancer needs to be treated, obviously. Most of the time people will see that they start peeing blood, and that's usually a good indication to go see your urologist and try to figure out what's going on there. But when you come and talk to us, we've already assumed you've been diagnosed with the cancer. You've already been treated with the cancer. The problem is the treatment sometimes causes secondary problems. So in order to get to a lot of different surgeries, like if you're going to do appendicitis, you go through the abdomen. If you're going to do like an orthopedic injury, you go right to the joint, right on the outside. But when you go to do something in the bladder, you actually stick a small camera up the urethra inside the penis, and you go all the way on up through the prostate. You know, the urethra goes right up through the prostate, and it goes up into the bladder. And in the bladder, they go in there and they burn out those little cells, or they resect the cancer. Sometimes they will put chemo directly into the bladder, depending on what they need to do, and then they will flush it on out. Well, that camera going through, while it's small, it is not small enough. And so as it goes up, it can cause some damage. And so what do you normally see after these procedures where, you know, what kind of disabilities are people complaining about?
So one of the things that we'll frequently see is trouble with urinary leakage or issues, initiating urinary stream, maintaining urinary stream, going more frequently. And we're going to ask you, as part of your VA claim, how often you have to urinate, do you have to go like once every hour, once every 2 hours? And how often do you get up at night? Do you get up 3-4 times at night to have to urinate? Another one too is urinary leakage, and do you have to wear urinary pads to absorb the urine? And also how often do you have to change them? So those are big ones.
Yeah.
Another one that we'll see is as a result of the procedures is erectile dysfunction or trouble initiating a erection after that procedure, which we see quite a bit.
Yeah.
What else do we see?
Well, so just to stay with erectile dysfunction, we did a previous video where we kind of talked about it in depth. But just really quickly, in case you haven't watched that, what we look for erectile dysfunction is we look, are you able to achieve an erection? Are you able to maintain an erection? Do you have an erection long enough for sexual intercourse? Have you tried medication? Does the medication work? Those are the kind of things that we are going to ask about. But erectile dysfunction is very common after these procedures that we see. Besides urinary leakage and erectile dysfunction, those are usually the two big ones that I see. But when we do talk to people, sometimes they'll still have a little bit of blood inside their urine. That unfortunately can last because they've done a lot of damage on up in there. The other thing too is that most people, when they file the claim, they're still on a surveillance or maintenance schedule where they'll still go in and get scoped every 3 to 6 months, pretty much for the rest of their life, at least for 5 years after the cancer, bare minimum. So we'll start, we'll see a lot of problems that'll continue to happen with it. With different little things, sometimes it is so aggressive that they do have to remove part of the bladder. You don't see that very often, but sometimes they do. And then at that point in time, when the bladder's been removed, unfortunately, a catheter is really your only option. So. while we don't really diagnose bladder cancer, we are seeing it a lot more because it sounds like, it just seems like the VA has finally gotten all those bladder cancer claims from Vietnam and Camp Lejeune, and they're just coming through all the time. And so if you do have a history of bladder cancer, make sure that you mention any urinary leakage problems and erectile dysfunction. It's embarrassing. I know it's embarrassing. As a doctor, we deal with embarrassing things all the time. It doesn't bother us, but it will definitely help out with your compensation and your quality of life.
Yeah, everyone wets their pants every once in a while.
Yeah, that's just, usually they're intoxicated or something else is going on. But yes, it's not embarrassing to us, and we'd like to talk to you about it, and we'd like to make sure you get accurately compensated for it.
Yeah.
So,
about all for bladder cancer, I think.
That's it for bladder cancer. Yeah.
We're the Disability Doctors. Please remember to like, comment, and subscribe so we can get this out there to as many veterans as possible.
Yeah. Thanks for coming and talking to us about bladder cancer.
Thanks.